Hello, and welcome to Ask a Naviguide, which is part of the Abundant Aging podcast series. I'm Mike, your host, and on this show, we tackle subjects in aging and family caregiving that can be pretty stressful to work through. And we do this with the help and advice of our skilled Naviguides here at United Church Homes. Our Naviguides have decades of experience helping families work through these issues, and we want to help everyone, everywhere, age with abundance. So we're lucky to have Robin with us today. And today we are going to talk about all things insurance. I know, exciting, right? But this is important because when you turn 65, your world kind of changes when it comes to your health coverage in the United States. And, you get to know or be more familiar with Medicare, Medicare Advantage, and Medicare supplement insurance. And I want to start off this show. This show is really going to talk more about the basics. We can't cover everything, but at least we can kind of share a little bit more about the history of these programs and how people might choose between them when it comes time to choose. So, Robin, Medicare, Medicare Advantage, Medicare supplement insurance, what's kind of the difference between all of those?
Good morning. Thank you for having me. So with Medicare, it does take over once you retire and go on Social Security and you're no longer working. And typically what it does is it will pay for 80% of covered costs. There are some other things in there as well, but that's the general. So people had a 20% that they would be responsible for. So originally what was very popular was Medicare supplement plans. They did have several plans to choose from, but the most popular was Plan F or Plan G. Both of those plans, if Medicare paid any portion of a claim, then they would pick up the balance. So hence nobody had any out of pocket, which was wonderful. When you first turn 65, you're in what's called open enrollment. And so when you turn 65, you're in guaranteed coverage. So you can choose any Medicare supplement coverage plan company, the one that has the best rate for you, and you're all set. But after that 6-month period, you might encounter some health issues. So as the years go on, your premiums go up every year with your age for most plans. You may look for other coverage, but if you've had health issues, now you have to go through underwriting and it's not guaranteed coverage. Your premiums at this point could have raised significantly. It has very easily gotten to the point where someone may have to choose between getting their medications covered, getting groceries, paying utility bills, and that's where the issue arose. And that's when the Medicare Advantage plan was born.
That's the first time it's kind of been explained to me like that, and that's really interesting. So before Medicare Advantage, you have traditional Medicare, which has a set level of coverage. People do pay premiums for Medicare, right? Do they usually come out of Social Security? Is that how it works?
Correct.
Okay.
Yes, if you've worked into the so many quarters, then Part A is covered. There's no premium technically. Then Part B, yes, there is an amount taken out every month. Like right now, I believe it's $164.
Okay. Yeah. A lot of people don't know that, right? I mean, a lot of people don't know that
Right.
they think Medicare is free, but no, that it comes out of
Mhm.
Social Security. So then you have that covers 80% of the costs. Is it
Mhm.
80% like no matter what? Like if I turn 65 and then 6 months later something horrendous happens to me and then I'm going to need millions and millions of dollars in coverage, Medicare will cover 80% of that, right? Is that the idea?
Yes.
Okay.
That's correct. I mean, there are, like I said, there are some other things like when you go to the hospital, you have a deductible, but in general, and you also for Part B, there's a small deductible every year. But other than that, once you meet those deductibles, it is just a flat 80%.
Okay. And so they'll pick up the cost, but then the remaining 20% I would be responsible for. And that
Correct.
20% is what I would have bought Medicare supplement insurance so that they would, and
To
I
pick
pay a
up.
little bit each
Mhm.
month. And off the top of your head, how much did a Medicare supplement insurance plan cost per month or what?
Even right now, when you first get one, if you're a woman, it's a little less expensive than a man, but I'm around $100 a month.
Okay. So, all right. So I'm on Medicare. I'm 65. I'm paying, let's say, 265 bucks a month, 264, whatever it might be. And then as I grow in age, I get my health conditions might get a little bit more significant. The supplemental insurance
Mhm.
plan will know that, it may cost a little bit more to cover me. So they'll raise premiums, which they're allowed to do. And before Medicare Advantage, then that's where you kind of got into trouble, right?
Well, except for with Medicare supplement, it's not based off claims history. It's strictly based off your age. So it
Oh,
goes up every year.
okay, perfect. So everything goes up with age. I mean, that's what's one of the
Mhm.
things we need to understand is that, as you age, again, your costs of health increase and they will be reflected in premiums that you pay. So Medicare Advantage was born.
Mhm.
What's a Medicare Advantage plan?
Okay, so those were designed for people that had those increased premiums. And again, they were having to make those tough decisions on what if they were going to pay those premiums or if they were going to use that money for other things. So the Medicare Advantage, there is no monthly premium. There's copays, much like traditional employer type insurance. So there's more cost sharing for the member than there is with a supplement. So you're getting rid of the monthly premium so you have extra money in your pocket, but you could have higher cost shares if you had a medical event or if you go to the doctor a lot, if you see specialists, if you have a lot of testing, things like that. And that sounds great, especially to those individuals that really don't go to the doctor very much. But when you have someone that does incur maybe a chronic illness, not necessarily a large event like a heart attack or something like that, but someone that develops type 2 diabetes that maybe already had diabetes, but it's getting a little worse and now they have neuropathy and maybe their kidneys are starting to have some issues, different things like that. That's when it becomes troublesome. With Medicare Advantage plans like employer insurance, there's networks involved. Even though Medicare Advantage plans must base how they're going to pay something off Medicare guidelines, they can also create their own guidelines on top of that. So, although something might not have had a prior authorization requirement under Medicare, it now will under a Medicare Advantage plan. So, you have networks to choose from, you have prior authorization guidelines, and that's where it can become a little tricky.
What is someone's experience like? Let's say I go to the doctor for a regular checkup, and
Mhm.
I have Medicare and I have a Medicare Advantage plan. And is the experience more on the doctor's side, for the Medicare Advantage versus Medicare, or do I even notice the difference when it comes to that?
As long as your doctor's in network, you won't notice the difference. It
Are,
typically is on the billing side. That's where they notice the difference
are all doctors in network with Medicare? Pretty
for the most
much.
part. I mean, I suppose you might find someone in a very rural area or something like that, but yes. And
Okay.
actually all over the world.
Oh, okay. Okay.
Yeah. Medicare, if you're traveling, that is the other. If you're a snowbird or if you like to travel in your retirement, you would want to really look at that because Medicare Advantage plans do cover emergency, but it's typically emergency room or urgent care. If you have to stay in the hospital for a long term time, in a hospital, when you say long term, you might be looking at a week or two,
Sure.
but that could be problematic with a Medicare Advantage plan.
Okay, so if you're someone that is looking to travel a lot, snowbird, you may
Mhm.
spend months outside the country, may look at more traditional Medicare as your benefit versus a
Mhm.
Medicare Advantage plan.
Even though a lot of Medicare Advantage plans are very large companies and they may have a huge network for employer type insurance,
Hmm.
the network for Medicare Advantage is based on the county that you live in.
Just dive into this a little bit because I just
Sure.
comes to mind is that if I'm on an employer plan for years and years and years, that's kind of what I'm used to, right? I'm used to things like in-network doctors, out-of-network doctors, HMO plans, PPO plans. HMO plans, I have
Mhm.
to see certain doctors,
Mhm.
but I guess it's kind of like I'm 65 and now I'm on Medicare Advantage. It's kind of like I'm kind of got a parallel experience, right? Mm,
It is,
yeah.
except for the networks. I don't know
Okay.
if I can say an insurance company to give you an example.
Sure.
Okay, so United Healthcare is one of the largest networks for both employer-based or individual type coverage as well as Medicare Advantage. However, when you're in a Medicare Advantage and looking for a network, it is a different network. But if you had an employer-based insurance and had United Healthcare, I believe it's one of the largest networks in the country, so you would not see the same issue.
Okay. Let's say if I'm on an employer plan, XYZ health insurance company provides that health insurance. I turned 65. I'm searching for a Medicare Advantage plan. I've liked my experience with my health insurer so far. XYZ plan has a Medicare Advantage plan, and I
Mhm.
choose that. But in choosing that, it could be the case where, my doctor might be out of network now or something similar. Is that what you're saying?
Yes, but locally, you're probably not going to see much change. It is mostly when you travel.
Okay.
So if your doctor took XYZ locally, more than likely they're going to take it with a Medicare Advantage plan as well. It's really the trouble comes when you travel. And also too, the benefits will be different. So with Medicare Advantage plans, you're really looking at the county that you live in. So you go by zip code. You typically will also look at the medications that you take, also your preference of doctors or network. So those are the types of things that you kind of plug in when you're looking for a Medicare Advantage plan. It
Okay,
wouldn't be just saying, well, I was really happy with this company here, so that's the Medicare Advantage plan that I'm going to choose.
got it. So if we could run this down, what are the things that people should check before they choose a Medicare Advantage plan? You mentioned obviously your doctors being in network, but if you can just kind of restate
Mhm.
that and say, three, four, or five things that you should be looking at and considering.
So the premium, if you can easily afford a supplement premium, that would be one thing. As far as Medicare Advantage plans, you would just look at maybe a worst case scenario in 1 year. If you had to go to the hospital, if you had several specialist appointments, a diagnostic testing, that sort of thing. And your agent can help you do this. If you look at your summary of benefits and see what a worst case scenario would be, because with Medicare Advantage, the nice thing is they do have a maximum out of pocket. As we said with traditional Medicare, it's just 20% forever. So if you couldn't afford that maximum out of pocket in a worst case scenario, then a Medicare Advantage plan would be fine for you. And it could be fine for many years, where you have very low out of pocket. But then in the event that something happens in one particular year, if you can afford that max out of pocket, then that would be great.
Yeah, so that's important because I know that, give you an example, if I have an employer-based plan and something terrible happens, that often these insurance plans have a deductible and then they have what they call a maximum out-of-pocket spending for each year, right? So if I were
Mhm.
to unfortunately get sick in, let's say, December, and I were going to the hospital and I had a Medicare Advantage plan, then I would basically pay out of pocket to my maximum out of pocket, right? Is it the deductible
Mhm.
plus the out of pocket, or is it just the
It's
just
everything. So with Medicare Advantage plans, like for instance, in the hospital, most plans have a situation where you pay a certain amount for like the first 5 days. So it could be $250 a day for the first 5 days. And then, of course, you have your co-payments for doctors and specialists. And then it's typically a co-insurance for diagnostic testing. So those are the types of things that you look at until you reach your maximum.
gotcha? So you reach the maximum, and then in
Medical
January I reach my
durable
maximum, but
equipment.
that's it, right? I mean, the insurance
Mhm.
takes over. And
Yes.
I'm not wedded to my Medicare. I mean, just like my employer has a plan, and I kind of take the plan my employer has. But in with Medicare Advantage, I
Mhm.
mean, you can change every year if you wanted to, right?
Yes, there's a annual open enrollment from October to December every year.
Got it. And I think the last question I'm going to ask for this podcast is: I've heard that Medicare Advantage plans have what they call supplemental benefits, um,
Mhm.
and that's different from traditional Medicare, right? What are
Very,
supplemental
yes.
benefits?
Okay, so there are additional benefits that the companies offer, such as transportation. You might get 20 one-way visits per year to medical appointments, which is lovely for a lot of seniors that maybe don't drive anymore. There is a over-the-counter benefit. It really varies based on whether you're on state assistance or not, but you can get anywhere from maybe $50 a quarter to $200 a quarter. Even now, there's a grocery benefit for one of the companies where you get $130 a month for groceries. It's you get a debit card is what it is, and they refill it every month. Some of them offer a utility benefit. There are a lot of exercise plans or fitness centers that are free membership.
So it just clicks for me here that these supplemental benefits, I guess the Medicare Advantage providers are recognizing that not everything that benefits your health and wellness is just from visiting the doctor, right? I mean, they want you to
Right.
have healthy food, they want you to exercise, they want you to age abundantly, right? And so they want to give you these
Yes.
benefits that will help with wellness because they know down the road that that might keep your health from getting worse. So that's very
Hmm.
interesting. And I suppose that that's sort of another factor when you're choosing a Medicare Advantage plan is that one company may offer one type of supplemental benefit or another, and you shouldn't base your decision on choosing a Medicare Advantage plan solely on the supplemental benefits, right?
Correct. And as a matter of fact, a lot of people kind of start out that way. They might hear that their neighbor has this benefit and they want to know, well, why can't I have that? But again, you want to plug in your medications first and you want to plug in your network of doctors first and make sure that those are covered. And then from there, you can kind of narrow it down to the other benefits.
That's great advice. So when you're choosing a plan, plug in your
Hmm.
doctor, make sure that the doctor's in
Yep.
network, plug in your
Your
medications, and
pharmacy network that you prefer. Hmm.
yes, pharmacy network that you prefer, the premiums, of course,
Mhm.
And then, the icing on the cake, so to speak, might be these supplemental benefits, right?
Yes. And there's a lot more to that as well,
Yeah, sure.
because, it depends on your income. There's extra help you can get from in general and that sort of thing, but that is the basics.
And the basics, it just in talking with the basics, it just opens up so much more in terms of things that we could talk about, and so those are going to be part of future episodes, I suspect. But for this one here,
I
I think
think
we're going to
so.
leave that here for this episode. And thank you, Robin, for sharing this knowledge with us. And thank you, our listeners, for listening to this episode of Ask a Naviguide. Again, it's part of the Abundant Aging podcast series brought to you by United Church Homes. If you like this week's show, please like, share, subscribe. I know every single podcast host says that, but like, share, subscribe, that would sure be awesome, so we can bring you more of this great content. For more information about the UCH Naviguide program, please visit www.uchnaviguide.org. And for more information about United Church Homes, visit www.unitedchurchhomes.org. See you next time.